Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated patients and medically complex patients at home, including Home TPN, Home BiPAP, Home CPAP, and also for adults and children that are at home with a tracheostomy but are not ventilated. Now, in today's video blog, I want to answer a quick question from one of our readers, John. John is 85 years of age. He says, I have been diagnosed with B-cell lymphoma, and since then I've had 2 tumors on my lung. Now I have a nodule on my right lung and a nodule on my tracheostomy. And I have been having a tracheostomy for the last 2 years. I'm 85. Should I have surgery, or should I just go home and have palliative care? Now, John, I am very sorry to hear about your situation, and it's a very difficult question to answer. Here, and I am not an oncologist, I am not a cancer specialist here, or you probably need some involvement from, a cardiothoracic surgeon. You probably need some input from ENT, from oncology, to see what your next steps are. Now, purely from a care perspective, if you do have surgery and then you need to go home, potentially with a tracheostomy or on a ventilator, intensive care at home is certainly the right place to do that. Or even if you want to go home and not have surgery and just have palliative care at home, once again, intensive care at home is the right service to choose, because we have provided palliative care to many similar clients than yourself that go home for end-of-life care with a tracheostomy, sometimes on a ventilator, and they might have end-stage cancer. But the most important part here is, what do you want? Do you want to spend more time in a hospital? Do you want to take the risk of surgery? I can't answer the question for you, but what I can offer you is, one way or another, that, you don't want to spend time in a hospital, which is evident from your email, and you want to go home, whether that's after surgery or going home without surgery for palliative care. One way or another, we can help you with that by sending our intensive care nurses to you, and your family, making sure you don't need to go back to hospital, and have quality of life and quality of end of life at home in the comfort of your own home. I really hope that answers your question. I know that's a very difficult situation for you, John, and it takes careful consideration for you to make a decision. I encourage you to reach out to us here at intensivecareathome.com. Give us a call on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com, so we can look into your situation further and guide you through it step by step. Right. Now, if you have a family member in intensive care on long-term ventilation, tracheostomy, BiPAP, CPAP ventilation, home TPN requirements, IV electrolyte infusion requirements such as potassium, magnesium, IV antibiotics, you should reach out to us, because we can help you get your loved one out of intensive care as quickly as possible, and help you there. If you're at home already and you have insufficient support, if your loved one or yourself is on a ventilator, tracheostomy, even if you have a tracheostomy and you're not ventilated, if you are on BiPAP, CPAP ventilation without a tracheostomy, please reach out to us. We can help you improve your quality of life. If you think you don't have enough funding, please reach out to us as well. We can help with funding. We always help our clients to get the funding they need through our advocacy. Otherwise, we wouldn't be in business. Furthermore, if you are an NDIS support coordinator and you have participants that need intensive care nursing at home through their NDIS plan, we encourage you to reach out as well. if you don't know how to obtain NDIS nursing funding for your participant for ventilation, tracheostomy, BiPAP, CPAP ventilation, please contact us as well. We can help you with the advocacy or with an NDIS nursing assessment. Currently, we are operating all around Australia in all major capital cities as well as regional and rural areas. We are an NDIS approved nursing service provider. We are in Victoria a TAC approved service provider. We are a DVA approved service provider all around Australia with the Department of Veteran Affairs. We are an iCare approved service provider in New South Wales and an NIISQ approved service provider in Queensland. And we also provide our own NDI specialist support coordination. So if you need an NDI support coordinator, specialist support coordinator, if you're not on the NDIS yet, please reach out to us as well. We can help you with that. Now, furthermore, if you are a critical care nurse and you're looking for a career change, please have a look at our career section on our website at intensivecareathome.com. We currently have work available in Sydney, Brisbane, and Melbourne, as well as the rural areas in Victoria, Queensland, and New South Wales. We require a minimum of 2 years CCRN experience, ideally with a postgraduate critical care qualification. And if you're an intensive care specialist, an intensive care ICU consultant, please contact us as well. We are currently expanding our clinical team, our medical team as well. We want to hear from you. And if you're an intensive care specialist and you have bed blocks in your ICU, we want to hear from you as well, because we can actually help you managing your bed blocks and exit blocks in ICU. And again, most of it is NDIS funded and you wouldn't even know about it. And if you are a hospital executive watching this, we can also help you once again eliminate your bed block, bed blocks, and help you free up your most valuable bed in a hospital, which is the ICU bed. Now, we also, like I said, we also provide NDIS nursing assessments. We also provide medical record reviews, and we also have a membership for families of critically ill patients in intensive care and intensive care at home at intensivecaresupport.org. We want to hear from you with your situation so we can help you very, very fast. Now, thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care and intensive care at home. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thanks for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.